Well, we've done these events before with presidents and CEOs, COOs of manufacturing. And, we really thought that, and we knew in our hearts that these lean tools were transferable to healthcare. And healthcare community really needs some assistance to see how beneficial lean is. So we sent out an invitation. It's called Learning to See, and this was our first run at Learning to See for healthcare professionals and presidents. So we invited everybody in the community in Rhode Island, parts of Connecticut and Massachusetts, and opened our doors to a 3-hour walkthrough so they could see end to end from when we first have contact with the customer through the processing of whatever that customer wanted, in our case vibrators, and then at the end through shipping, and then the follow-up, and all these different tools that we've implemented here in Lean. And we wanted to share that with them because they are totally transferable into a hospital-type organization. To get the healthcare providers here, first off, it was really pulling teeth in a way. And I had to, they came on just my personal recommendation, calling in favors from friends on their personal recommendations because I knew it would be impactful to them. I knew it had great, great, great impact and long-lasting impact for them. So finally, once they came, and they saw this. They were skeptical at first because they didn't understand how a manufacturing company could show healthcare providers that have gone to school for a long time, have very, very strict work instructions, and have all kinds of regulations that they work with. How the heck was a manufacturer going to show them this process? Well, when they came through the door and they started their tour and they could see the sheer passion here in everybody's eyes for standard work, for pokios, for doing kanbans, for listening to the voice of the customer, they were blown away. The letters afterwards that came into us were of such deep, deep understanding of the culture. That's what they wanted, was the culture, because they're in a high pressure type job. And with that high pressure comes, a lot of double looking, double checking, and they could see that we were in a high pressure job too in manufacturing, and how we streamline this using lean tools to make our days more enjoyable and go easier. I felt a social responsibility to share the lessons that we learned in healthcare. And every president, everybody that touches or comes in contact with our organization, I try and stress the profound effect that we have on our communities. There's no one looking out for our communities more than business owners and leaders in leadership roles, and it's our job to share with people the lessons we've learned for the betterment of our community. I stress it all the time to everybody.